I'd first like to thank the council, the board of directors, Paul, and everyone that was involved. I think whoever came up with the idea of a Black Health Alliance Legacy Award, that was brilliant. It's really good. I have to thank first and foremost my wife and my family. Ava, who's here with me today and has been with me for about 22 years. Actually, it's interesting, the same year that BHA started, we also got married that same year. So there's a lot of ceremony and significance in that time. And she has been a rock, my support, an advisor, counsel, support, everything that you can name. And couldn't be possible without her. So I love her much, and I just wanted to let her know and everyone know that she's special to me. Thank you. I wanted to, about a year ago, a gentleman, a fellow colleague in the community who works with a number of community organizations, asked me to speak to him about some community organizations. He has a community organization that he's been working on and has been building for a number of years, and they were having some challenges and growing strains and so forth. And he wanted to speak to me about just some of the learnings, I guess, that BHA that haven't been established a little bit longer than that organization. So we had a very good conversation, and it was interesting because it gave me an opportunity to really reflect on where we are to where we are today, the now and the then. And so I'm going to share some of that with you. You know, how many people know the song "Many Rivers to Cross" by legendary Jamaican? Oh my goodness. Who knows? Can tell me? Jimmy Cliff. Correct. It's a beautiful, beautiful song. A great voice. No, you guys didn't pay for that. So it's a beautiful song. It speaks about challenges. It speaks about some of the loneliness, but also speaks about perseverance. And when I really think about the journey of the Black Health Alliance, from where it began, its humble beginnings, where it is today, and its trajectory in terms of where it's going, it reminds me the title, "Many Rivers to Cross," is appropriate. And I think really when we think about the many rivers to cross, the many rivers to cross refer to some of the challenges and the obstacles. Where we live, Ava and my family, we live close to the Don River. And the Don River, actually, this time of year, we have the salmon that go up the stream. And so the Don River, you know, goes north and goes south and empties into Lake Ontario. And we would often go down and just kind of sit on the banks and essentially watch the salmon. And the salmon are pretty good, they're pretty large-sized fish and so forth, and they're swimming literally upstream against the current. And there are many rivers, when you look at rivers, they're not all the same. Some are shallow, some have rapids and rocks and so forth. And in the area that we're sitting in and watching them, there's also about a 4 to 5 foot wall, literally a wall, that the salmon have to jump and clear to be able to make it their way up. And so not only are they going against the current and the stream, they also have several obstacles along the way, not the least of which is this 5-foot wall. And when we sit there, you know, we're cheering along, go Nemo, go, and really watching them and jump. Many of them jump and don't quite make it and fall back down. And they try again, they jump, don't quite make it and fall back down. And sometimes I think in terms of the journey that we're taking and the journey of the Black Health Alliance is like that in many ways. I remember times when we would apply for funding to support initiatives that work in the community, and we get a response back that our budget is inappropriate. Although we've made sure we've submitted it, that's reasonable, it's appropriate, but yet it's turned back and said that as to suggest the work that we're doing is less valued and it should be only at a substandard level. I remember occasions when we're applying to, in case of Taibu, and defending our priority population, and defending the services of what we know needed to be delivered. And again, pushing back, saying, well, why don't you guys just serve newcomers? Why don't you just serve refugees and so forth? And so there's a constant re-education, a constant battle of defending who we are, what we need to do, and why is that the case. And that's kind of like swimming upstream against the current. It's really the currents and the rocks and the wall is like anti-black racism. It's systemic. It's constantly going through. You're constantly having to sort of educate and inform and defend why you're doing what you're doing. Not all rivers are like that. There are other rivers as well, too, that are wide, are deeper, and on the surface look calm. A couple of years ago, about 10, 15 years ago, my family and I were in Jamaica at Little Ochi. And we're just relaxing with a bit of a family reunion, going to the beach. And I'm a pretty decent swimmer. I'm Pisces and so forth, so I take to the water. And out, a little further out, there are two young guys. There's no lifeguards or anything like that on the beach or anything like that. There's no little buoys that telling you don't, swim past or don't go beyond this point. Anyways, the two young fellows out there, one of them started to scream, help, 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 help. I started to swim out towards them. And one of the other guys swam back. And as I was swimming out towards him, I was probably about the same distance, maybe 4 or 5 feet from me, the young man just went down. It was too deep. You couldn't even see where he was. I looked and so forth, and eventually had to swim back in. About an hour and a half later, about half a kilometer down the beach line, his body showed up, and he was dead. Sometimes the rivers that we're trying to cross, the obstacles aren't as visible. They're not the rocks, they're not the rapids, they're not the wall that you can clearly see. Matter of fact, it looks smooth sailing, like you could just paddle across, no problems. But the dangers or the threats are undercurrents. And you don't know when you're going to get them, you don't know when they're going to attach you, and if you're not careful, they pull you down, and you end up a half a mile downstream, dead. Sometimes within organizations, those challenges come internal. And that's what I describe or liken that analogy to. Those are the hidden, unknown to you challenges that may come from those that are even close to you within your organization. Anytime in any organization, in a family, if there's any group that consists of more than one person, there's going to come a time where there's going to be a different of opinions, a different of approach, and a different of ideas. And so sometimes, and within the Black Earth Alliance, these are some of the things that we faced as well, in which the agenda of individuals may not be in alignment with the agenda of the organizations, in which the approaches are different. And understanding that these people are often good people, just passionate and as committed as you are. And you have to find a way to respectfully and with some level of diplomacy to engage and to resolve as best as these kind of challenges. Because these are the type of things that, unfortunately, do end great initiatives, great opportunities, and so forth. And I think we've been able to, over the years, rather successfully navigate these kind of things. And that's important. Those are some of the rivers that we've had to cross. The other thing I wanted to point out, and I couldn't think of a song title to reflect it, but it's a quote that I like. It's better to be prepared and not have an opportunity than to have an opportunity and not be prepared. In the early years of the Black Health Alliance, in the first couple of years, I guess the origin of the Black Health Alliance really came from an observation and a belief. The observation is that there were a number of people, community leaders throughout the area, whether that be in sickle cell, Lily Johnson, whether it be Donna Alexander in substance abuse and mental health, whether it be Shannon Ryan in HIV and AIDS, whether that be Leela Springer in breast cancer, and Kathy Nelson, diabetes. All wonderful, passionate. These are people that the community literally courses through their veins. and working hard, diligently in the area. And I just thought that if there was an opportunity where we can convene and provide a platform in which we can bring some of these voices together, that if we can improve the communication, that could lead to better collaboration on global initiatives that would benefit the community broadly, then that thirdly would lead to change. And the change that we'd be seeking was to advance or improve the health and well-being of the Black community. All right. And so when in the early couple of years, within about a couple of years after that, the federal government of Canada had what's called a Romanow Report, reshaping the future of healthcare in Canada. And that was an opportunity where we sort of pulled the work of all the different organizations, whether it be in diabetes, mental health, substance abuse and addictions, breast cancer, et cetera, and pull that and present the argument that this is the lived experience. These are the realities of Black people in Canada. And tie that in with the need and the argument for particular programs, better research, better advocacy around how to meet those specific needs. And even though that specific presentation, that document and that body of work may not have had a direct result from that federal report, that actually set the stage for 2 years later in the province of Ontario, they did a similar primary health care reform. And that was at the time when Taibu and the BHA put forward that initiative. The groundwork had been set. The coalition, the partnership, the information had been done the 2 years prior. And so when the opportunity became available, we were ready to go. One of my most proudest moments with the Black Health Alliance, I remember it distinctly. It was a February evening, cold, it was snowing, and it was the first meeting where the members of the community were to get together to talk about putting forward an application to support and establish a community health center with a primary objective of serving our community. And it was held at Women's Health and Women's Hands. Unity Johnson was the executive director at the time in their boardroom. And I came down, and the room was full. It was just packed. A lot of the members of that we had worked with over the years, and a lot of new people, health professionals, community workers of all strata, who were bought into the idea and so forth. And I remember going home at the end of that meeting saying, yeah, this is going to happen. It's definitely going to happen. And so being prepared is the best thing to do, right? And so I think when I think about the board and the work that they've done and the strategic plans and where they're heading and where they're going, it's in complete alignment. And I've been so blessed to work over the years with so many great fellow board of directors, J.R. Dash, that are some of them that are here for a long time, Yvette, Floydine Charles Friedel, and many, many others. And it's those opportunities, those friendships, those partnerships that have made it meaningful and memorable. I think I'd like to close by saying, as I start off by saying, there are many rivers to cross. The Black Health Alliance, there will be many more rivers to cross. But if the work is done with diligence, with integrity, and commitment, I'd like to end by saying one of the things that I've really embraced as well, too, that if we cross the river together, the alligators won't bother us. Thank you.